Thank you, Catherine. And I think you're particularly interested in the comments you made at the end around the whole issue of poverty and deprivation and how that impacts on certain communities more harder than others. But also there's some of the prevention versus cure issues, that examples that you highlighted, and particularly the area of, I think you called it autonomy and empowerment and how that helps. So well done, and thank you, Catherine. Okay, now going to pass across to Nicki Killeen. Nicki Killeen is from the HSE Social Inclusion Office and will have been behind many of the innovative initiatives that you heard Eamon earlier on talking about, particularly the whole issue of nighttime economy and the whole issue of festivals and drugs. Nicki's been behind a lot of that. So, Nicki, over to yourself. Thank you.
Thank you so much. It's an absolute privilege to be here with you today, and happy Pride. So I'm going to talk today about different user groups than what you may have heard of, but why we need to adapt how we respond to our very new drug landscape. So when we're looking at drugs in Ireland, we now need to recognise that the landscape has significantly changed since we started this discussion in the 80s, with a focus on dependencies and opiate populations. So for some time we have used data from our treatment services on the general population data, and they are very useful, and the people coming into our services are the most marginalised and most impacted by drug harms. And of course the general population will help us see the health of people over time. But we need to change how we approach this. We need to adapt, we need to know more, and we need to adapt our services. So there's limitations with the approaches that we have been taking. We may not actually know everywhere that people are using drugs. We may not know everyone who's using, and we may not know everything they are using. So as part of our emerging drug trend projects in the HSE, we're looking at the other user groups and the gaps in our knowledge and the gaps in our services. So we're looking at groups who are using new drugs in new ways. We've heard from Gary on the needs of women. We need to look at other genders and how they're using substances and what their needs are. And the nightlife setting, which will be the focus today. So when I'm talking about the nighttime economy in terms of the HSE's work, we need to recognise that use is occurring in bars, pubs, nightclubs, festivals, unofficial parties. For the initiation of our project, we have focused on festival settings, but all nightlife settings now are risk-taking settings. There's high volumes of drugs being used in risky ways. And I suppose from the HSE's perspective, we see the nighttime economy as a positive setting where we can reach people that we're not currently reaching. So traditionally our services are set up at dependencies, and all of these other user groups may never have a dependency and therefore may never come into our services. So the focus of my presentation today is our Safer Nightlife programme, which is focused on festival settings, which we piloted last year, and we're currently in the middle of implementing this summer. It's a multi-component campaign, so we've had different tiers. We've developed resources, which I've left for everyone. There's one for everyone in the audience. You will see our vibrant approach on what we're educating these young people on in terms of the risks associated with drugs and how to reduce the harms. We've media and social media presence, and we're sharing information to reach all of these people who aren't coming into our services. We should acknowledge, though, that information provision alone has limitations. So you can provide young people with information and that may never change their behaviour. It's really important for us to reach them, engage with them and have cultural competence on what's going on in these settings. So this is why we are now delivering outreach on harm reduction. So last year we were very concerned about the drug market following the COVID-19 pandemic, and we quickly developed recruitment process and training for volunteers. So we have an amazing pool of people who come and give us their time to work with us at festivals. We have a recruitment process where we try to get a diverse range of people, so people with more experience and less experience. So we use everyone from drug project workers, psychologists, nurses, peers, nightlife reps, and we develop a tailored programme where there's peer learning amongst the group, but that they're going out into this space prepared. People who are using drugs in these settings are very educated. They're using drugs that people in drug services may not see on a daily basis, and they need a different type of information. They need a different type of support for them. So with this programme, we've developed a training which will look at the basic pharmacology of drugs, socio-cultural influences, really intricate harm reduction interventions that we can go out and deliver. So our training programme now is a one-day in-person training, and we've many different people that help so that we're ready to identify the signs of a drug emergency and ready for those discussions. So our harm reduction is based on the same ethos that would have been shared by other speakers, in that it's pragmatic, non-judgmental and meeting people where they're at. So last year we would have ran our harm reduction at 2 festivals while we worked on proposals with the Gardaí, Justice and Department of Health to expand our service to include analytical components through back-of-house drug analysis. So those proposals were signed off and ready for Electric Picnic last year, and we've ran the programme at 3 events now, with 2 over the past 2 weeks. So how does it work? We have a drugs.ie tent at the festival. We'll be operating there for about 9 hours of the day, and we'll have our wonderful volunteers doing outreach to the campsites. We're checking in with people, how they're getting on. Some of our interactions can range from very brief interactions to very detailed discussions on how those people are going to use drugs and what they are using. With our lab on site, we have surrender bins that people are welcome to come to the HSE tent and surrender. In agreement with Justice, Gardaí and Department of Health, these are safe spaces, so people can come in, receive a health intervention and discard of those drugs, which will be analysed by Sinead McNamara and the National Drug Treatment Centre team on site. Just to point out, the below bin is people dressed up at Electric Picnic. I would not encourage anyone to give your drugs to those people, only the green bin on top, please. So what we're looking for in the drugs are if they are adulterated, if there's something in those drugs that's quite concerning, or if there's high strength. We will review and then we'll issue an alert, with those alerts going on the festival screens, apps, social media, and we use it through our engagements. So we've many benefits and outputs that we're reviewing as part of this project. We're working with very new stakeholders that the health service have never worked with before in nightlife settings. I think it's really important to show that this is a really good example of justice and health working on a health-led strategy. I can't commend the Gardaí enough for their support with this project, in particular Drugs and Organised Crime Bureau and the local Gardaí, who support us with having a safe space for people to come and donate drugs for health purposes.
Just 1 minute, Nicki,
no problem. So I suppose looking at changing the mainstream dialogue, we need to recognise that non-dependent populations need harm reduction. We need to encourage them to engage with our services and reduce the harms. In terms of our analysis, we've had 177 samples so far across the 3 events. This is the first time we've ever quantified MDMA, and we found 4 new drugs at Electric Picnic, and from the past 2 festivals we've possibly found 3 new drugs which have never been found before in Ireland. So this shows we are reaching hidden groups and we are learning more about our emerging drug trends in ways we never have before in Ireland. So in terms of our next steps, we're going to have a report in the coming weeks with feedbacks from our volunteers to improve our volunteer training. We hope to formalise that and have a more structured training programme. We need to improve our research and have other monitoring projects. We need to expand harm reduction for non-dependent user groups. They are at risk of drug market changes, and an example of that is the years 2012 to 2017, where we'd 40 deaths linked with the substance PMA and PMMA. We do need to look at a dedicated lab in Ireland for emerging drug trends. We now also need to discuss front-of-house drug analysis, where people can directly give the health service their substances and receive a tailored health intervention, which is a secondary step to the back-of-house approach that we're currently applying. Finally, to close off, we need to continue working to expand this to other nightlife settings with Health, Justice and the Department of Culture.
Well done.
Thank you very much.
Thank you. Thanks, Nicki. And a great example, as Nicki describes it, of a very changing landscape, but a new way of reaching people. So we understand that changing landscape and reach them in a very different way. So thank you very much for that, Nicki.